Good evening. I'm Haylee Ficuciello for Englebrook Independent News. Tonight, we turn our attention to a disease that many Americans have not thought about in years, but one that public health officials around the world are now watching very closely. Ebola. For many people, the name alone brings back memories of frightening headlines, emergency health screenings, and images of healthcare workers wearing full body protective suits. And now, in 2026, Ebola is once again making international headlines. The World Health Organization has declared the current Ebola outbreak in Central Africa a public health emergency of international concern, the highest level of international public health alerts. The outbreak is being driven by a rare strain known as the Bone virus, one of the several strains capable of causing Ebola virus disease. Unlike some previous Ebola outbreaks, there is currently no widely approved vaccine specifically targeting this strain. That reality alone has health officials concerned. Tonight, we examine what is happening, where the virus is spreading, how deadly it has become, and whether this growing outbreak could have significant impacts on international travel, including the upcoming FIFA World Cup match scheduled to take place here in New Jersey. Ebola virus disease is one of the most deadliest infectious diseases known to humanity. It is a viral hemorrhagic fever that attacks multiple organ systems and can cause severe bleeding, organ failure, stroke, and death. Symptoms often begin with fever, severe headache, muscle pain, fatigue, and sore throat. As the disease progresses, patients can develop vomiting, diarrhea, internal bleeding, external bleeding, and multi-organ failure. The disease spreads throughout direct contact with the infected bodily fluids, contaminant material, or infected animals. It does not spread through casual airborne transmission like influenza and COVID-19. However, Ebola's extremely high fatality rate makes even limited outbreaks a major concern. Historically, fatality rates have ranged from approximately 25% to as high as 90% depending on the strain and the availability of medical treatment. The current outbreak originated in the Eastern Democratic Republic of Congo, commonly referred to as DRC. Health officials believe that the outbreak was spreading for weeks before it fully was identified. That delay allowed infections to spread throughout multiple communities before emergency measures could be implemented. As of the latest reporting, the World Health Organization reports approximately 906 suspected cases and 223 suspected deaths. Some estimates from Africa CDC places the numbers of suspected cases above 1,000. Confirmed infections have been reported in provinces of Ituri, North Kivu, and South Kivu. These regions have long presented challenges of public health officials due to conflict, population displacement, and limited healthcare infrastructures. Health authorities have also reported attacks on medical facilities and resistance to contaminate efforts in certain areas. Such conditions make outbreaks control significantly more difficult. WHO officials currently estimate the death rates among confirmed cases may range between 30 and 50%. This is extraordinarily high mortality rate compared to most infectious disease. The outbreak is no longer confined to the DRC. Uganda has confirmed imported cases tied to cross-border transmission. Current reports indicate several confirmed infections and at least one death associated with the outbreak. Ugandan authorities have responded aggressively. Measures have included enhanced surveillance, contact tracking, border controls, public health messaging, restrictions on certain forms of travel. Officials have urged citizens to avoid behaviors that could increase transmission risks. Uganda's Ministry of Health has activated emergency response teams in affected regions and continue to monitor exposed individuals. At present, there is no evidence of widespread community transmission inside Uganda, but health officials remain concerned because of the close connection between affected areas of DRC and neighboring countries. The primary countries currently affected by confirmed Ebola activities are Democratic Republic of Congo and Uganda. However, international health agents have identified additional neighboring nations as being an elevated risk because of the migration patterns, trade routes, and population movement. Those countries include South Sudan, Rwanda, Burundi, Tanzania, and Kenya. Health authorities also monitoring traveling routes connected to Central Africa to Europe, the Middle East, Asia, and North America. The concern is that infectious travelers may unknowingly transport the virus before symptoms develop. The Center for Disease Control and Prevention has increased monitoring efforts related to the outbreak. Federal health authorities have implemented enhanced screening procedures for travelers arriving from affected regions. The CDC has advised travelers who have recently visited affected countries to monitor themselves for symptoms for 21 days after departure. The agency has also emphasized that anyone experiencing symptoms should seek medical attention immediately and avoid further travel. Additional entry restrictions and screening procedures have been announced for travelers with recent travel history involving Democratic Republic of Congo, Uganda, and South Sudan. Federal officials stress that the current risk of the general American public remains low. However, health agencies continue to monitor the situation closely. Now, let's discuss this question many viewers may be asking. Could this outbreak affect the FIFA World Cup match scheduled for the United States, including games taking place in New Jersey? The honest answer is this. At the moment, there is no identification the World Cup match would be canceled, postponed, or relocated because of the Ebola. However, international sporting events naturally attract millions of travelers from around the globe. MetLife Stadium in New Jersey is expected to host several World Cup matches and related events. If the outbreak continues to expand internationally, health authorities could implement additional screening measures for travelers arriving from the affected region. Potential measures could include enhanced airport screening, health questionnaires, travel history verification, contact tracing protocols, and increased monitoring of arriving passengers. Again, there is no indication that FIFA, U.S. authorities, or New Jersey officials are considering any changes to the tournament schedule, but public health planning for major international events often involve preparing for scenarios long before they become emergencies. That preparation is already underway. Several factors make up the outbreak particularly concerning. First, the Bonnebajo strain lacks an approved vaccine compared to those available for some of the other Ebola strains. Second, the outbreak is occurring in a region already challenged by armed conflict and population displacement. Third, delayed detection allows transmission chains to become established before intervention efforts begin. And fourth, health officials continue reporting shortages of resources needed to fully contain the outbreak. The good news is that modern surveillance systems are far stronger than what they were during the devastating West African Ebola epidemic of 2014 through 2016. International agencies have experience, healthcare systems have protocols, diagnostic tools are better, and public health coordinators have improved. Those advantages could prove critical in preventing a wider international spread. For now, the outbreak remains centered in Central Africa. The risks to average Americans remain low. But low risk does not mean no risk. The ongoing Ebola outbreak serves as a reminder that infectious diseases do not recognize borders, political parties, or national boundaries. A virus emerges in a remote region today and can become a global concern tomorrow. Public health officials, international governments, and healthcare workers are racing to contain the outbreak before this happens. We'll continue monitoring developments, including any changes in CDC guidelines, international travel advisories, and any potential implications for major events such as the 2026 FIFA World Cup. For Englebrook Independent News, I'm Haylee Ficuciello. Thank you for watching.